Hi, I'm Jacob Berger. I work at Smiles at Lakewood Ranch as a dentist here, and I'm going to be talking about the DiSC profile types and how important it is to help out with patients, both to read it and figure out what they are in the DiSC profile types, and then how to speak to that personality type. It's so important that you don't talk to somebody on your personality type and how you like to be spoken to, but how they like to be spoken to. It helps with case acceptance, patient satisfaction, really with the flow of the entire interaction with a patient. This is huge for hygienists, the assistants, office managers, and definitely the dentist in those moments to be able to interact, answer questions, and really make the patient feel like they're being heard and listened to. You can tell the same person you need a crown in 4 different ways. And that's what I'm going to be doing with these patients, both for a D personality type, I, S, and C. So this first personality type is a D personality type. And this is a really difficult one to present treatment to. It's a really good one and an easy one for your team to pick up on. This patient is going to come off as kind of rude, and what you have to do with those patients is really let them know the straightforward answer of, you need a crown, it's going to take this long, and let's just get you in and out. I have some of these patients even take off their bib before I walk in the room. They're trying to get out the door. That is a barrier that you think you're going to work on me today, I need to get out of here. So they'll take off their bib. They'll let you know, I have 10 minutes and I have to be out of here. And you'll see that with this next patient. Those are the types of cues you don't want to try to push and say, well, can you stay for 15? Can you stay for 20? Give them what they want and they'll be a patient for life. They're not rude, and if you can kind of match that in that moment, they're going to go tell everybody about how you're straight to the point, you get the job done, and you respected their time. I even have these patients get calls back later if we want to try to finish the appointment quicker. And through those things that you do, they'll be taking mental notes. They realize that you're respecting that for them. So my assistant got a chance to go over the pictures, the x-rays with you, just knowing that you need that tooth worked on. Any questions that you have for me or thoughts?
How long does that procedure take?
Usually it'll take about 60 to 90 minutes. And if you'll block off about 90 minutes of your time of your day, I'll be able to take care of it in that time frame. Then I have to see you back in about 3 weeks so I can put the permanent crown on.
All right.
That appointment also takes some time, and it takes about 60 minutes. So if you're okay with it, I'll have one of my business assistants get you the cost and go through that with you. Is that okay with you?
Yeah, I need to be out in the next 10 minutes, so if that's okay.
Well, knowing that you only have the 10 minutes, I want to honor that, and it seems like time's important to you. So what I'll do is I'll go talk with them right now and see if they have a moment to do it with you. And if you're open to it and they can't get it done, can we give you a call later on?
Yeah, absolutely.
Perfect, and we can get that started as soon as you're ready to get started. Maybe
Tomorrow? Do you have any availability for tomorrow?
we might be able to make tomorrow happen for you.
Afternoon.
Afternoon work? Perfect. So I'll get you in, I'll move some stuff around. We'll get started right when you walk in, and I'll have you out within about 90 minutes.
Sounds good. Let's make it happen.
All right, let's get started on this. So with the D personality, you probably saw a lot of those traits that I was telling you about, and my goal is to get the patient in and out as quick as possible and get moving on. That is the complete opposite of this next personality type, which is the I, or the influencer. And the I personality is more of a bubbly personality. They probably took the day off just to be here. I love working on I personalities. It's so easy to work with them. That is probably because I am an I personality and I can get along with an I, but even if you're a D, an S, or a C, in those moments you just have to kind of mold in the moment and realize this person likes to talk. They don't want just the facts. They don't need all of the details. They just want to know that you're a fun dentist, you're going to make a pretty crown for them, and that they love the office. The conversations are going to go differently, the cues are going to be different, and we'll get right into that video now. Hey Adri, nice to meet you. I'm Jacob Berger.
Nice to meet you.
My assistant got a chance to show you some things on the x-rays and go over a little bit of what you're going to need. I figured there'd be some questions or some things you'd want to know, so hit me with any questions you might have.
Yeah, so I've never had a crown before, and I really like the way my teeth already look. I know it'll probably be towards the back, but just how does a crown look compared to my other teeth?
Oh, we want to make it look pretty. We want to make it look like it matches, and as long as it fits good, feels good, then the pretty part I'll make sure is right for you, and we can always go back and get another one if it needs to be done. As far as when we can get started, we'll probably get started as quick as you want to get started. Anything as far as work or any barriers for you?
I can make it fit.
Cool, if you can make it fit, that works out great. When I walked in, the first thing I did notice, and I had to point it out, was your shoes. It looks like you got a brand new pair of shoes.
Yes.
Are you into shoes? Is that your thing?
I love shoes. I have way too many pairs, and yeah, I thought it coordinated with my outfit pretty nice today, so
well, I'm all about shoes, and I could tell also that the nails were done as well, all sparkly and glittery.
Everything color coordinated, my watch, everything has to be black and white for today, so
well,
yes.
I love it. What we can do is, if you're cool with it, I'll make your crown look glittery like that. Can I do that?
Can we do that? That
That'd
would be
cool.
perfect.
That'd be cool.
Yes.
Let's do this. My business assistant, she can go over the cost with you and the process with you. If there's any questions about the details of it, I'm happy to go over that. But I'll go grab them now so they can go over the cost and stuff like that. Does that sound good for you?
Absolutely. Sounds great.
Good. Deal. So with that I personality, you probably saw that we spent more time talking about things that were not related to dentistry. And that's the beauty of an I personality. They're there, they probably took the whole day off that day. They just want to chat and talk about what's going on in life. They're going to show up in a way that allows us to know that they're an I right off of the bat. The S personality type is the majority of people. And this personality type is very quiet. They don't speak up too much unless they're with friends and family. And this personality type wants to feel comfortable, not taken advantage of. They're not going to be the loud ones. They're not going to ask a lot of questions. They're just going to sit there and learn more about what's happening and take in the environment. Some of the interactions that I see and the way the patient is responding could be related to looking down at the floor, legs crossed, arms across their body. They may not be making eye contact with you. They're not trying to be rude. They're nervous though. Now these things aren't evident when you look at an S personality's interaction, and you'll notice that in this next video here. Heather, it's nice to meet you.
Nice to meet you.
You got a chance to go over everything with my assistant, look at pictures and x-rays, and I just want to see if you had any questions related to the crown that we need to do.
No, not really.
All right, that makes it easy. It doesn't have to be many. What I like to do is just make sure that you know the process and what we need to do. Any questions about the process or the crown itself? Have you ever had a crown before?
No.
Okay, so it's gonna be a little new for you, but what we do is we work on the tooth, and usually only takes about 90 minutes of your day. I won't work on the tooth for 90 minutes, but we'll work together for about 90. Then I'll see you back about 3 weeks later to put the actual permanent crown on, and you'll have a temporary crown in that process. As far as time of the day that works or best day of the week, is there any certain one that works best for you?
Mid-morning, middle of the week.
I think we can make that work. If there are any questions, don't hesitate to call later or call again on another day. You can even stop by or write down a question at your next appointment. I'll make sure I go over it with you so you feel comfortable about anything we're doing. Sound good?
Sounds great.
Cool. I'm glad I got a chance to meet you, Heather, and we'll get ready to fix that tooth as soon as possible, okay?
All right, thank you.
You're welcome. Now, the dangerous part about an S personality is that they'll tell everybody about their situation or their experience, but they won't be telling you or your staff. And that could be when they're sitting in the waiting room or when they're sitting in the chair. So don't expect to know much about their experience, whether it be good or bad. And that's why you just have to be very careful with this big chunk, whether it be 75 to 80% of the population, that you're just taking really good care of them. Now, the next personality type is the C. Now, the C personality type sometimes can be a difficult one to deal with. They ask a ton of questions, and these questions may be dumb questions to you. They may be questions you're like, oh, here we go again. Conversations are gonna take longer, but if you don't answer those questions, they'll go to the next practice. And answer those questions and try to get to the point with them. They may need printouts and brochures. They may need to know the pros, the cons, the whys, and the whats. Now, if you want to rush a conversation with them, it's going to be difficult because before you can finish answering one question, they're already asking the next one. And you'll see that here in this next video with this next interaction. Jamie, it's nice to meet you. You got a chance to chat with my assistant about what you need, the x-rays, the photos. I wanted to see if there was any questions or concerns about what we're doing for you.
I do have a couple. Mainly, so I have some treatment questions, and then I have some financial questions,
Okay.
if that's going to be okay.
Well, my team for sure can help with the financial questions, but I'm happy to help with the clinical questions or the questions related to the teeth themselves.
So they can talk, because I have insurance coverage, and it's really important to me to know, like, because I think I have a waiting period. Actually, no, I know I do. It's about a year, but I want to make sure that the costs that you give me are the best, are accurate.
For sure, and cost is really important when it comes to dental treatment. Let's for a moment, we'll take the cost and we'll set that aside for a little bit. We'll chat more about what's going on with the teeth and the mouth, how I can help, and things like that. Make sure it fits good, feels good, and looks good. Did you have any questions about the process to make the crown happen or anything like that?
I'm curious, what material are you going to use? There's porcelain and metal, and then there's all sorts of things, and I got a little bit confused.
For
So
sure.
what's going in my mouth?
There's a lot of materials, and it sounds like the details of it are important to you. So what I can do is I'll get you a printout with the different materials that are on the market, the ones that I'll probably use, and then we can talk about if you have pros or cons about one of them. That way you can make a great decision about it. Does that sound good?
Yeah. Am I going to be able to eat normally, or are you, like, how is that going to work? Because I want to make sure that when I'm out, nothing like the temporary doesn't fall.
Those
or
are
how...
very, very valid questions. I get those all the time. You'll definitely want to chew on the opposite side, have somewhat of a soft diet, but my assistant can go over how to care for it, how to make it fit good, look good, and then make sure that it's not going to pop out on you. If it does, we'll get you right back in to make that happen.
Okay.
But it is a very good question, and we'll make sure that happens. Now what we can do is we'll look at your schedule and see what works, and we'll get you in as quickly as we can so we can fix that tooth.
And but I can call, though, if I have any other questions?
You can, and I want to make sure you know that you can even reach out to me or I can reach out to you, and along this process you'll know everything that you need to know so feel comfortable about what you're getting done, and just know no question's a dumb question. You can ask as many as you want, In fact, I'd encourage you to even write them down.
Okay,
Sound good?
that sounds great.
Jamie,
Yeah,
I'm glad I
thank
got
you.
a chance to work with you and meet you. I'll see you soon, okay?
Thank you.
With a C personality, you may want to answer these questions, but you're going to have to reel them back in. There's going to be times where you have to let them know that question's something I can happily answer. And after I answer that for you, let's move on to any other questions that you have, almost speeding up and guiding the conversation for them. If not, you'll be going off on a tangent with them. They're going to ask questions not even related to the treatment, whether it be insurance or how long did you practice, where did you work, where did you go to school. Just answer those questions, laugh with them a little bit, let them know that their questions are important and that you would have asked the same question, almost giving them a sense of confidence that that wasn't a dumb question, and let your team know to do the same thing. So personality types are so helpful in an office setting. It doesn't matter what position you have or hold, it doesn't even matter what personality type you are. As long as you learn it and figure out a way to try to mold, it's going to make practice so much easier for whatever situation you're in. Now, there is a curveball, and that's some patients are not going to be just an I, just an S, just a D. There could be a combination, and you may even watch that transformation happen as they get to know you as their dentist or you as the hygienist. I have patients who show up as an S, and they're quiet the whole time, but before the appointment is even over, you realize quickly that they're an I with their best friends, and even with you now that they're comfortable. And you have to mold with them. When you see that, you can transform. Instead of being that caring person, laugh with them. Start asking them about their favorite shoes, their favorite things to do, their favorite movies, or if they are a D personality and all of a sudden they're starting to open up and ask more questions and you see that C personality come out with them, start to answer questions and even ask them questions. This is definitely something that you have to be moldable and adaptable in these moments. You can't just present on one the whole time, but it's important to be aware of what you are, what your team members are. This will even help with interactions with your own team members. I have team members that I know not to talk to in a certain way because they don't need to know all those details. I have an I personality that I know she just wants to have fun. She doesn't need all the answers to every question. So mold, have fun with it, learn it. It's easy stuff. It's all over the internet. You can really study DiSC profiles and utilize it for your benefit, and it makes practice and everyday work so much better.